My name is Hillary, and today I'm going to talk about how to safely take the drug Metformin. I will also discuss 3 important side effects that this drug can cause. I will also teach my patient 3 side effects that she should tell her doctor about, and I will make sure that my patient understands all this information clearly. My client is a 58-year-old white female who has been recently diagnosed with type 2 diabetes. She has no allergies. She's always struggled with being overweight. She also has a history of high blood pressure. She has a poor diet filled with fried foods, and her energy level has decreased or lowered in the past 5 years. I also learned that both her parents were diagnosed or had type 2 diabetes. The reason she takes metformin is to help lower her blood sugar levels. She also needs metformin to stop her liver from making extra sugar when not needed in her body. So, metformin is a pill. It's taken by mouth. So, when a doctor prescribes metformin for an adult, usually the starting dose or beginning dose is 1 500 milligram pill 2 times a day, or he can start them on 1 850 milligram pill 1 time a day. But my patient, her doctor prescribed her 2 500 milligram pills in the morning and 1 500 milligram pill in the evening. So, since the doctor didn't specifically say a time in the morning or the evening, she needs to make sure she does it the same time in the morning and the same time in the evening every day. So, I reminded my patient also, she should not crush this pill. She needs to take it whole. When she takes this pill, she can have it with meals to decrease or lower her stomach problems like throwing up, upset stomach, watery stools or poop. And she also may have a metallic or metal taste in her mouth. I made sure that the patient understood to make or take this medication as the doctor ordered, and at the same time every day, just like I said. She also needs to read her labels carefully and store her medicine in a safe place. She will never skip a dose on purpose or take an extra pill if she misses a dose. So, she also will not stop taking this drug or medicine unless her doctor says so. She will not miss her scheduled doctor's appointments because the doctor or the nurse needs to check her kidneys to make sure that they're working properly. This drug, metformin, is very specific to having correct kidney function. So this is very important. Also, I reminded her to be sure to tell the doctor about any upcoming surgeries, because this drug, metformin, will need to be stopped 24 to 48 hours before her surgery, and it needs to be held or stopped also after her surgery. So it's very important she tells her doctor, hey, I'm on metformin and I have a surgery coming up. Also, if she needs to take any other type of medication, she needs to talk to her doctor first to make sure that this is okay. So 3 side effects she needs to tell her doctor about or report to her doctor or weak muscles, throwing up, and feeling confused. These side effects can lead to other important problems, so it's very important to tell the doctor as early as possible. I also taught my patients to remember to be more active to help lose some weight. And to do this, she can also increase or eat more fruits and vegetables in her diet. She needs to make sure she drinks more water and to also keep a sugary hard candy, for example, in her pocket when she's exercising. This helps decrease her chances of having a low blood sugar while exercising. So my patient knows also she needs to go to the eye doctor regularly because now she's a type 2 diabetic. So she also needs to check her feet for any cuts or bleeding on a regular basis. As the nurse, I watch my patient carefully and correctly administer her morning dose as prescribed by her doctor. So remember, that was 2 500 milligram pills in the morning. So I watched her take it. She did it correctly. And then she told me that this evening when I get home, at the same time that I normally take it in the evening, I will take 1 500 milligram pill. And I will take it with food, and I will take it with a glass of water. I will increase my water. So me as a nurse, I know she knows how to take her medicine. She knows the frequency or how much. She knows how many pills, and she knows that she's going to be not crushing it, and she's going to be taking it by mouth. So at the end of our visit, I asked her, do you have any more questions or concerns about taking your drug, what to report to your doctor, or side effects you need to be aware of when taking this medicine? She said, I feel confident, I know what to do, I know what to report, I know what to expect from this drug, and I know how to take this drug. I thanked her, and I wrote down on my documents exactly what took place that day. So, thank you. I hope this helps you better understand how to take metformin and what to do if you are taking it. Thank you.